Hi everyone, welcome to Raaonline. Today we'll see about an important topic of the liver, the cirrhosis and portal hypertension. We'll first see about a patient history. A 50-year-old male, chronic alcoholic with complaints of fatigue, loss of weight, yellowish discoloration of sclera, abdominal distension and pedal edema. LFT is performed and it shows elevated liver enzymes, increased serum bilirubin, decreased serum albumin and prothrombin time and activated partial thromboplastin time is prolonged. Chronic alcoholic with jaundice, loss of weight, abdominal distension, pedal edema. This is the finding. So, what is your diagnosis? It is, yes, cirrhosis. So, what is cirrhosis? It is irreversible and chronic liver damage. The hepatic stellate cells, they produce highly fibrogenic myofibroblasts. There is also associated alteration of the hepatic blood flow and the hepatic perfusion. Continuous evolution of this fibrosis leads on to cirrhosis. It is diffuse remodeling of the liver as a result of insult to the hepatic parenchyma, parenchymal regenerative nodules, vascular shunting and fibrous bands are the hallmark of cirrhosis. Incidence, it's more common than we expect. More than 10 lakh cases are detected per year in our country, and treatment, we can only manage the condition, but there is no permanent cure. Liver transplantation of course plays an important role, but still it's not an absolute cure or remedy for the cirrhosis. Diagnosis, it requires extensive testing by biochemical and pathological tests and also radiological imaging studies. Cirrhosis can last for several years, sometimes lifelong. It's commonly seen in patients who are more than 50 years, and family history in certain types may increase the likelihood of evolving cirrhosis. History of cirrhosis. So, the word cirrhosis is derived from the ancient Greek word which means to turn reddish yellow and tawny. It was first used by René Laennec, and he used this term cirrhosis to describe the gross appearance or the macroscopic appearance of fibrotic changes in a liver with alcoholic liver disease. So, it was first used in a patient with alcoholic liver disease, meaning reddish yellow and tawny. So, stages of liver damage. This is an healthy liver. Initially, it leads to fatty liver, which is steatohepatitis. Then, as a result of regeneration, it produces liver fibrosis and ultimately cirrhosis. Gross appearance of cirrhotic liver. Another picture showing cirrhosis liver. So, initiating factor is hepatocyte necrosis as a result of any form of injury to the hepatic parenchyma. This hepatic necrosis is followed by fibrosis with regeneration of nodules. Thus, see how the liver appears. It is in the form of various nodules. It can be macronodular if it is more than 3 mm, like in hepatitis B, micronodular if it is less than 3 mm as it occurs in alcoholic liver disease. So, depending on the size of the nodules of the regeneration of the hepatic parenchyma, it can be micro or macronodules. Moving on to the causes of cirrhosis, mainly it can be, the two are the important cause. It can be either viral hepatitis or alcoholic liver disease. So, we have to know about viral hepatitis and alcoholic liver disease. These two are the important causes. Viral hepatitis, especially the B and C. Alcoholic liver disease, chronic alcoholic. Now, of late, as I told in the previous lecture, Non-alcoholic fatty liver disease is also evolving as an important cause of cirrhosis other than these two. Other causes include lysosomal storage diseases, the metabolic liver diseases like hemochromatosis, Wilson's disease, alpha-1 antitrypsin disease. Then immune-mediated inflammatory disease like autoimmune hepatitis and primary biliary cholangitis, primary sclerosing cholangitis. Cardiovascular diseases like venous outflow obstruction, chronic congestive right heart failure and chronic biliary diseases like bile duct stenosis, and medications, especially chemotherapeutic drugs like methotrexate, the cardiac drug amiodarone, and granulomatous diseases, the systemic sarcoidosis and infectious cystosomiasis. So, I want you to remember these three causes: viral hepatitis and alcoholic liver disease, then NAFLD. There are certain diseases which are not accompanied by established cirrhosis. These include the autoimmune diseases like primary biliary cirrhosis and primary sclerosing cholangitis and the infection with cystosoma. Diseases, cirrhosis may be present but they will not progress to end-stage liver disease like treated autoimmune hepatitis, suppressed hepatitis B and cured hepatitis C infections. So, this is the gross appearance of cirrhotic liver. Normal liver, fatty liver, see the color change, it is yellowish discoloration of the hepatic parenchyma and some nodules are also seen, minute nodules. This is a well formed cirrhotic nodules. So, this is the cirrhotic liver grossly. Based on the size of the nodule, it can be micronodular or macronodular. Micronodular means the nodules are less than 3 mm in diameter. So, it is very small. Tiny nodules are there. What are the conditions where we have micronodular cirrhosis? Alcoholic liver disease is the important cause of micronodular cirrhosis. Then comes hemochromatosis. Please remember, micronodular cirrhosis is alcoholic liver disease, especially in the early stage. Then hemochromatosis and rare conditions.